Here's our heart. So at the bottom here we have the apex, this point, and then the top is referred to as the base. So on our anterior side here we have the right atrium, which then wraps around to the posterior side to the right ventricle. And then again on the anterior side we have the left atrium, which again wraps around to the posterior side to the left ventricle. Then up top here, this little toothpick marks our right pulmonary artery, which is then attached to the superior vena cava. And then this guy that's been slit open here is going to mark our pulmonary trunk, which deep inside here, kind of hard to see, but we will have the pulmonic semilunar valve within that. And then over here is our aorta, which is kind of a jumbled mess, but if we pry in here, we can actually see the aortic semilunar valve. Then between the right atrium and the right ventricle over here, we have our tricuspid valve. So you can see the three cusps right there. And then between the left atrium and the left ventricle over here, I believe I cut it off, but the bicuspid valve should connect the left atrium to the left ventricle. I believe it's these two guys right here, but I'm not positive. That is the only thing I could find that looked like the bicuspid valve, but it would connect the left atrium and the left ventricle. So that is my heart dissection.